Are you feeling anxious because your doctor mentioned that your AMH levels are low and now IVF seems to be your only option? Now, before you rush into that decision, stick around. This video could change how you approach your fertility journey. AMH, or anti-Mullerian hormone, is a hormone that is produced by small follicles in your ovaries. It's often used as an indicator for your ovarian reserve. But here's something many women don't hear enough. A low AMH doesn't necessarily mean that you have no chance of having a healthy number of follicles. In fact, many women with low AMH still have a good count of antral follicles, meaning IVF may not be necessary. See, AMH levels can vary throughout the day and even between labs. So it's crucial to evaluate them alongside other factors like your number of follicles, the size of your ovaries, and your age. These combined factors will give you a fuller picture of your fertility potential. Believe me when I say this, a lot of women with low AMH conceive naturally. Studies show that while AMH may sometimes reflect the quantity, it does not necessarily reflect on your egg quality, which is probably the most crucial factor for conception. Now, doctors often suggest IVF when your AMH level is low because it allows them to retrieve multiple follicles in a single cycle, potentially maximizing your chance of fertilization. But however, IVF success depends on a lot more than just AMH. Factors like your age, your overall health, and your partner's fertility also play key roles. It's also important to understand that IVF isn't a guaranteed solution for women with truly low AMH. In fact, many of these women require multiple cycles of IVF just to retrieve a good number of embryos. Now, imagine the emotional toll of going through all these cycles. It's not as simple as just doing IVF and getting pregnant right away. And let's also not forget the impact of a failed IVF cycle. This can be emotionally devastating. So remember to take your time, explore all your options, get a second opinion if needed, and make decisions that feel right for you. Now, if your doctor is suggesting IVF solely based on a low AMH value, it's worth asking about your alternatives. While I personally would not recommend timed intercourse, lifestyle changes, or basic ovulation induction, there are other options that you can look into. Now, one such alternative is superovulation. It's a process in which medications are given to you to stimulate your ovaries to produce multiple follicles during your natural cycle. It's a less invasive and more affordable option than IVF, and it can also be paired with IUI, also known as intrauterine insemination, if your partner's sperm count is average or low. Now, for women who have truly low AMH due to premature ovarian failure, a condition where ovarian function declines earlier than usual, the approach varies based on age. Younger women can consider egg freezing to preserve their fertility before ovarian reserve declines further. If you are ready to conceive, trying 4 to 5 cycles of superovulation before moving to IVF could be a good approach. For older women, especially those over 35, 2 to 3 cycles of superovulation may be enough before transitioning to IVF. Now, for women who have low AMH, advanced age, and previous IVF failures, there are newer treatment options that they can consider before trying IVF again. Platelet-rich plasma therapy involves injecting PRP derived right from your own blood into the ovaries to potentially rejuvenate the ovarian function and improve egg quality. Stem cell therapy can also be considered, where the stem cells are collected from your bone marrow and are used to rejuvenate the ovarian tissue. Although these treatments are still relatively new, some of the women I've treated personally have successfully conceived naturally after undergoing these therapies. If you would like me to create a separate video explaining more about ovarian rejuvenation with PRP or stem cells, let me know in the comments down below. Being told that you have low AMH can feel overwhelming, but remember, your fertility journey is personal. Now, don't let this one number dictate your next steps. If this video helped clear things up for you, give this a thumbs up and don't forget to subscribe for more science-backed fertility insight. Have questions or you want to share your experience? Drop a comment down below. We'd love to hear from you. Until the next one, see you and have a lovely day.